Bismillah ar-Rahman ar-Rahim. My article for this week is titled as Regenerative Endodontic Treatment with Orthodontic Treatment in a Tooth with Dense Evaginatus. It is a case report with a 4 years follow-up that is done by Natera and others. They are a group from New Jersey and it is published in the JOE in 2018. So, recent publications have shown that regenerative endodontic procedures have become one of the treatment options for immature permanent teeth with pulp necrosis and apical periodontitis, that is aiming to induce apical growth and promote the thickness of the dentinal walls. And with this treatment option, the age of the patient group treated usually ranged between 6 and 17 years, and it is possible that those patients may undergo a future orthodontic treatment. However, the literature is not very clear regarding the precise effect of the orthodontic tooth movement with the regenerative endodontic procedure. So this is a 14 years old female patient that presented with discomfort in lower left premolar, tooth number 20, as the pain started 3 weeks after a general dentist adjusted the occlusion. Clinically, tooth number 20 had dense evaginatus with no carious lesion, with the negative cold test response and tender to percussion and palpation. Also, two sinus tracts were presented buccally and lingually. Radiographically, a periapical radiolucency was noted with an immature root apex, and the tooth was diagnosed as pulp necrosis with chronic apical abscess. The patient and the parents were informed about the treatment options and the risks, and the regenerative endodontic treatment was chosen for tooth number 20. As the treatment was done on 2 visits using the triple antibiotic as intracanal medicament and MTA as a capping material with composite resin as the final restoration. Upon the 4 months follow-up, the periapical radiolucency was resolved, and on the 1 year follow-up, orthodontic treatment has been started that was planned for 2 years. And in the 4 years recall, the tooth remained asymptomatic with no evidence of root elongation or thickening of the canal walls. Also, the apical healing was achieved, but no further root development was radiographically observed. Also, the tooth did not respond to cold or electrical bulb tests. The authors consider the treatment in this case as success, even though there was no significant root development. That is based on the AAE criteria for the success in regenerative endodontic procedures, where only in this case the primary objective was achieved, as the tooth remained asymptomatic and there was no evidence of, or there was a clear evidence of periapical healing. One important consideration in this case is the impact of the orthodontic treatment, and currently the quality of evidence in this area, it remains limited, as most of the available literature consists of case reports rather than a high-level clinical evidence. However, from this case, the tooth responded to orthodontic treatment similar to the non-endodontically treated teeth.